So good morning and good afternoon to everybody. My name is Sarah Hess and I work at the World Health Organization in Geneva, Switzerland. I'd like to welcome you to this webinar today that I'm delighted to say is co-convened with UNICEF and Religions for Peace. This webinar is the first in a series that is focusing on COVID-19 vaccine communication. The specific title of this webinar is The Role and Impact of Faith Actors in Global and National Advocacy for Vaccine Equity and Access. So an incredibly important topic at this time. We have a wonderful group of panelists with us here today who I'm going to introduce. But before I do, I'm going to say that while this panel is wonderful and has really incredible stories to share, they are not at all representative, and we are aware that there are a large number of single faith and multi-faith actions that have taken place globally in response to the COVID-19 pandemic and in response to advocacy for equity and access. And as I mentioned earlier, this is a series, and so we look forward to trying to include many different voices as we go forward. So I'd like to welcome our panelists today. We have the Reverend Christo Greyling, who is the Senior Director for Church Partnerships, Faith and Development from World Vision International. We have the Honorable Ella Gandhi, who is a trustee from the Gandhi Development Trust and co-president of Religions for Peace in South Africa. We also have Dr. Mwai Makoka, who is the Program Executive for Health and Healing, the World Council of Churches. We have Dr. Leon Saltiel, representative at UN Geneva and UNESCO, and coordinator on countering anti-Semitism in the World Jewish Congress. We also have Dr. Mohammed Al-Sanusi, Executive Director of the Network for Religious and Traditional Peacemakers and core group member of the Faith for Vaccines movement. Welcome to all our panelists today. We will have a time for Q&A in the second half of the webinar, and so I'd like to invite listeners to please submit their questions into the Q&A function in Zoom. To make our moderator's job easier, if your question is directed to a specific panelist, please do so indicate in that question. Of course, we are recording this, so we will be able to share the recording afterwards to all who have listened. And so I would also like to welcome my co-moderators. We have B. Khan from UNICEF and Deepika Singh from Religions for Peace, and you will be hearing from them at various points today. So I'd now like to hand over to B for her welcome.
Thank you, Sarah. Good morning, good afternoon, everyone. Thank you so much for joining us on the start of the series of webinars that WHO, RFP, and UNICEF are jointly planning. My name is Bihan. I head the Civil Society Partnerships team with UNICEF based in New York. And one of our really, I think even before COVID came into being, for us, the role of working with faith-based organizations and the importance of that was always very critical. Whether it was working with polio, whether it was working on gender rights, on girls' education, we've always really felt that this work could not be done if we did not have the trust and the support of faith communities and faith-based organizations. And all of this just came even more stark and more clear when COVID hit, and we realized what an important role all of you played when it came to speaking to your communities, speaking with one voice on how to tackle this issue together. And so it's I'm extremely, extremely grateful for this opportunity to be working with Religions for Peace and WHO, but also the amazing organizations that are, and the panelists around the table today and to basically have all of you take part in this conversation, because I know that there's a lot for us to learn. There's a lot for us to discuss. And we hope that we continue this series for the next couple of weeks and months as we work together to figure out how to address the various nuances of COVID. So thank you very much for joining us. And it's really a pleasure to be speaking to all of you. Over to you, Deepika.
Thank you so much, Bea. Warm greetings, everyone. I join Sarah and Bea in welcoming you all. My name is Deepika Singh, and I serve as the Associate Secretary General and the Director of Programs at Religions of Peace, which is one of the largest multi-religious coalition with presence in 90 countries and 6 regions. We have been working in the area of peace and security, human rights and development through multi-religious collaboration for over 50 years now. For the past year and a half, all of us have observed and experienced the devastating toll brought about by the pandemic, particularly on those who are the most vulnerable among us. This has resulted in tremendous losses of lives and livelihoods, halting and even in some cases reversing whatever progress we have made. And at such a time, as Bea mentioned, in these difficult and challenging times, religious leaders and faith-based institutions have been playing a critical role. In addition to providing spiritual, mental, and psychosocial support, they have been delivering critical services ranging from providing life-saving goods to disseminating public health messages and inspiring hope, solidarity, and compassion along the way. As we embark on a very different phase of the pandemic, it is of utmost importance that the religious leaders and institutions work together and continue to leverage their influence, reach, credibility, and networks to secure equitable and easy access to vaccine for all. Therefore, we are most fortunate, as Sarah mentioned, that we have here with us today outstanding speakers who will share with us their insights, rich experiences, and work that they have been doing to advocate for vaccine equity and access. But before we listen to them, let us all observe a moment of silence for those who lost their lives due to COVID-19, for all those who suffered these tragic losses, and for those who are still continuing to be affected by the pandemic. Now, a moment of silence, please. Thank you very much. Over to you, Sarah.
Thank you very much, Deepika. We're now going to move into a moderated discussion with our panelists, and I'm delighted to direct the first question to Dr. Mwai Makoka. Mwai, many faith partners and faith leaders have made statements calling for equity of access to COVID-19 vaccines and action at global and national levels. What advocacy initiative to COVID vaccines have you been involved in?
Thank you, and I'm pleased to be part of this conversation on behalf of the World Council of Churches, and also to see some of our good partners and friends also on the panel, and I'm sure also among those that are listening and have looked in. As Council of Churches, we have indeed been involved with advocacy for equity and access to the vaccines. Towards the end of last year, we published a joint statement with the World Jewish Congress. And my friend, Dr. Leon, is going to speak more to that. But that was towards the end of last year. And early this year, we also made a statement written together with organizations. These are country-level Christian health associations, and also regional and global Christian health organizations and networks. And one of them actually is World Vision, and Christo is here with us and is also going to share his views and experiences to this. Some of our partners actually were able to make this statement and hand it to their respective governments. because really most of the decisions are made at the national level. So advocacy at the government level was very critical. Just towards the end of last month was the World Immunization Week. And the issue of COVID vaccines came in handy, as actually the world was commemorating the World Immunization Week. And we had the opportunity to partner more specifically with UNICEF. And we have 9 vaccine champions from among senior leadership of the World Council of Churches family. So these have been very critical advocates to speak for equity and access to the vaccines, but also to promote uptake of the vaccines. We have also been having many publications, either printed or online, social media, and many on our website on faith-based health education. Because we believe that health education should not be dichotomous. It's not only the education on the science on one hand, outside our faiths or our teachings. So we have had mostly education that is building on our faith, building on our beliefs that in accordance to that. And we do this mainly because we believe that we should be part of the solution and not part of the problem. In the midst of a global problem, we all need to be part of the solution. In that way, we can defeat the pandemic. Thank you, Sarah.
Thank you very much, Mwai, and I fully agree with you. You made reference to the joint statement between the World Jewish Congress and the World Council of Churches. I'd now like to ask Leon if you could elaborate a little more on the key elements included in that statement and why they were important for you as a religious representative and leader.
Thank you, Sarah, and I would like also to thank the organizers for this timely and very important meeting today. Indeed, as part of our regular dialogue with the World Council of Churches, early on we identified when vaccines were being started to be moved to consumption by the public, to think about the ethical aspects around vaccinations. We felt that not enough thinking had been done in the public sphere about how these vaccines should be distributed and who should be chosen to get the vaccine first. So we came up with a joint document, the World Council of Churches and the World Jewish Congress, reflecting on our religious values and using them as a guidance for policymakers on how this could go about. The document was issued on December 22nd, so very early on in the process, and was entitled Invitation to Reflection and Engagement on Ethical Issues Related to COVID-19 Vaccine Distribution. So shortly, the goal of the statement was to encourage religious leaders and faith-based organizations to play their properly needed role in contributing to public policy discussions on the issue of vaccination, guided by our common heritage. We stressed the need for equity, that the vaccine should be distributed without discrimination. We stressed the human right to health. We opposed any vaccine nationalism. We also confronted the unsubstantiated rumors and conspiracy myths around the vaccines, that they were hurtful or they were used for devious means, as a way of using our faith to protect science and not to undermine science and the right to health. And also very early on, we reflected about the use of a COVID passport. And we understood that it would be necessary. We understood that it limits certain civil liberties, but we felt that for the common good, it's important for a limited use of time to infringe about personal liberties in order to save the greater good. So I invite everybody to read this document. Maybe I could share on the chat, if Sarah, you allow, and then maybe people can read it and reflect on it and maybe find it useful for our conversation. Thank you so much.
Wonderful. Thank you, Leon. Please do go ahead and share it in the chat for all our listeners to see. I'd now like to move to Christo from World Vision International. Christo, can you tell us a little bit more about the COVID-19 vaccine advocacy initiatives that World Vision has been involved in? Over to you.
Yeah, thanks, Sarah. Yeah, World Vision actually has a long history of responding to epidemics. Our responses to polio, to HIV and AIDS, Ebola and Zika, has taught us immense valuable lessons that prepared us actually to act quickly in the COVID pandemic. And as Christians, our advocacy is always focused on solidarity with the most vulnerable, the marginalized, the poor, and of course, children. We believe that through prayer, we are actually advocating to God to bring about the change we need in our world. And just before Easter, we co-organized the Global Week of Prayer with World Council of Churches, with World Evangelical Alliance, Salvation Army, the Mennonites, and all their member churches. And in this week of prayers, there was one specific theme that focused on the equitable access to vaccines. This actually provided the opportunity to educate and inform millions of Christians about the need for equitable vaccine access, inequalities, and what the impact on children and families will be if it will not become available to everyone around. This helped to build a mutual understanding to what our Christian faith calls us to when it comes to loving our neighbor, to speak for the world's most vulnerable, and to demand justice in the midst of this crisis. Now, at the global level, we bring our community engagement experience into the COVAX facility demand side working group to influence that guidance. And as such, we have prioritized also our support for global advocacy that emphasize national investments into the equitable national deployment and vaccination planning processes, with a specific emphasis on the alignment with the WHO SAGE principles and on community engagement. And we have also signed on to the WCC call to action, as well as to the recent WHO Health Cluster call. Now, as important as global advocacy is for vaccine equity, we also know that national and community engagement is vital. People must have access to the accurate and trusted information about vaccines. And at national level, we created a checklist to assess and to understand the local national deployment of vaccine planning processes, and to identify equity gaps and to inform their local advocacy. So we also encourage our national officers to actually do a barrier analysis to understand what these local barriers and determinants are. And then we encourage the engagement of local communities and faith leaders in the NVDP process. And at community level, we are scaling up social accountability efforts to make sure that populations are informed on their rights and engaging duty bearers on identified gaps. And in this, faith leaders are key advocates within their community. For they are the ones who are sharing the right information, who combat misinformation, and are speaking up for justice. So it's a combination of global, local, and community engagement.
Thank you very much, Christo, for sharing with us. And I'd like to move to Dr. Mohammed Al-Sanusi. Can you tell us a little bit about the Faithful Vaccines movement? We see it on your background there. Over to you.
Thank you so much, Sarah, and you know, through you, I want to also thank the UNICEF, Religions for Peace, and WHO for hosting this critical webinar here. It's really an honor to join my colleagues, this esteemed panel. You know, faith for vaccines. We all know, Sarah, herd community will only be achieved if we adopt the whole of society approach to tackle this pandemic. And this means working closely with all segments of societies, and particularly with civil societies. And here I want to just bring the importance of SDG 17, which is really calling for close partnership between government and civil societies and everyone to address issues so that we can achieve our 2030 agenda. So faith communities, as I mentioned, and my colleagues already talked about the importance of faith-based institutions and faith actors, it is important to utilize our trusted messengers as well as to utilize our trusted locations. So we always say that, trusted locations and trusted vocation. Locations such as houses of worship and trusted messengers such as faith leaders to support vaccine equitable distribution and vaccine acceptance is very critical in this area, in this time. So I'm understanding that critical role of faith actors, myself, along with prominent US faith-based leaders, convened in early February to decide how to best address the gap between the role and capacity of faith leaders and the Biden administration's goal to vaccinate the US population. Through several consultations, we developed Faith for Vaccines. Is an inclusive multi-faith movement comprised of local and national US religious leaders as well as medical professionals who are working together to identify and resolve current gap in vaccine mobilizations, outreach, and uptake. Faith for Vaccines hosts bi-weekly roundtable, which has evolved to be a national platform for heads of denominations and medical professionals to convene in an interfaith setting to support and acknowledge a knowledge exchange for best practices in relation to the equitable vaccine distribution. We are honored to have a close collaboration with the White House, and always we have officials attending the table. What is a global connection, Sarah? This is a local US based. So while the initiative is initially focusing in the local in the United States level, the partners in the Faith for Vaccine table acutely aware, including through their transnational membership of the parallel global challenges. We look forward to collaborating with Religions for Peace and other global entities to address also the global need for that. And finally, we're working for Faith for Vaccine National Summit to be held on May 26. And we encourage everyone to join us as we continue to advance the role of faith-based leaders and institutions.
Thank you very much for sharing with us. And I do hope that you will post any links or information specific to that summit in the chat for all our listeners to be able to access that as well. Ella, I would like to turn to you now. South Africa is at a very different stage of vaccine rollout to some other countries in Europe and the United States of America. Could you speak to some of the advocacy work that has been undertaken by Religions for Peace in your setting?
Thank you so much for inviting me to this discussion. Firstly, I want to make 4 points on this question. The first point is that South Africa has semblances of first world countries, but also a large section of South Africa is in the third world situation. So therefore, South Africa cannot be compared with the US and UK. That's the first point. The second point is, it is important to note that in ensuring that our people receive the best possible vaccines with the least risks involved, South Africa experienced a 1 million dose delay because our scientists rejected the AstraZeneca vaccine, which they found would not work against the muted strain of the virus found in our country. We had to wait for other vaccines to arrive before we could start the rollout. So that was one of the delays. The third point I want to make is that in the midst of great inequality within our own country and between countries, the principle that binds all of us is that of vaccine equity. It means that everyone is entitled to receive the COVID-19 vaccine free of charge at an easily accessible point, provided by properly trained personnel and rolled out equitably regardless of their socioeconomic, citizenship, or other status. So nobody must be left behind. The vaccine is a public good to be available to everybody. Now, within that scenario, the fourth point is what have we done? So sometime back at the World Trade Organization, South Africa, together with India, led the proposal to waive certain intellectual property rights, like patents being enforced during this pandemic, so that many more manufacturers could start producing them in their own countries. This decision has been slow, even though the majority of WTO members support this proposal. That has led to the delays. But let me emphasize that the notion of interconnectedness and interdependence of us all and the planet we reside in has been enhanced by this virus. And it has clearly charted out the course, which says that we are all in this together. If one suffers, we all suffer. And to remove it, we have to all act together, or else it is going to be here to stay. Taking that into account, faith-based organizations in South Africa, together with civil society and trade union organizations and so on, at a broad-based, organizational level, we all came together to advocate for equity, for vaccine equity. And we have been, raising this issue with our government as well as internationally. And we've joined many of the groups that have spoken about this. So that is what RFP South Africa has been doing, together with others. Thank you.
Thank you very much for sharing. You reminded me of something our DG says quite often, that no one person is safe until we're all safe. And so really that notion of we are all in this together is important. Building on from what you just mentioned with regards to taking your advocacy to the national government, I'd like to ask Mwai a question. In what ways do you see faith actors holding the public and national leadership accountable for achieving vaccine access and equity?
Thank you, Sarah, but that's a difficult question. So whatever I say would be really by way of thoughts or examples of ways that this can be achieved, and not necessarily an exhaustive prescription of actions. But I think the first one that easily comes to mind is leading by example. There is nothing that beats a good example, nothing that beats an exemplary life and exemplary actions. So matters of love, care, compassion, caring for the other, seeing ourselves in the other, accountability, and all that, I think they come first to mind. And it's not only in this issue, but even other diseases, how faith leaders have led by example. The easier one to see is how we have HIV pandemic, when leaders stepped up to lead by example in taking concrete measures. I think in word and in deed, it made a huge difference. But also recognizing that leaders, especially political leaders, are, so to speak, keeping multiple balls in the air. They are juggling multiple balls in the air. Their priorities are so many competing priorities, and shifting priorities. So faith leaders should be able to speak to that and aware that times come when these, as these priorities change, they need to maintain some constant attention to what I can say, appealing to them to keep the main thing, as some people say, and to always work for the greater good. Because these priorities, sometimes they put the greater good on the back burner and they may prioritize some other interests. I think faith leaders have the potential and the responsibility to appeal to the political leaders, but also to the business leaders. But also the other area is to call attention to the weak, to the vulnerable, to the marginalized, and to those that are left behind, as others have already said. Speaking and calling this attention is very critical. I know in some countries I hear that some people would be afraid to go out for to get a COVID test when they were sick, because facing authorities would mean an arrest. Maybe they are illegal immigrants. So finding ways and mechanisms of ensuring that health is divorced from immigration rules, that would be a very important area. So that type of attention is not just speaking out, but finding ways and means to address some of these systemic gaps that may be there and that may make the weak, the vulnerable to be in much worse situation. The other area, to translate the language of policy to the language of the people. Many faith leaders are with people on the ground. They know their language, but also to transmit this language upwards from the grassroots voices and the pains and the aspirations and the fears of the people on the ground, to transmit this upwards to the leadership, helping the leadership to manage complexity. We thought, oh, when you have the vaccine, everything is done, but we see the issue is taking very unexpected turns. And the faith leaders must walk hand in hand with the leaders in government and other to manage this complexity. And above all, to remind everyone, as the previous speaker has ably said, we are one body and we all have a role to play. Let's all try not to be part of the problem, but part of the solution. Others are scientists, they are doing their part. Others are community leaders, they are doing their part. At least my part should not be to aggravate the problem. Thank you.
Thank you very much, Mwai. In spite of a difficult question, a really eloquent response. Because it was such a difficult question, I'd like to offer the same question actually to Mohammed. So what are your perspectives on the role of faith actors in holding public and national leadership accountable? Over to you.
Yeah, thank you, Sarah. And let me begin from where actually Moy left it there. And he addressed this question, we are one global body. And that sentence also has its own, religious connotation. We are one body. If any part of our body, ache, the entire body is suffering, and that is the global community, right? So that's why we need to look into that. But to directly answer the question, there is no doubt that faith-based actors and religious actors, they have a moral responsibility to address, this equitable vaccine distribution and access and combat any hesitancy. And they are well-positioned faith-based actors and religious actors to do that because they enjoy that trust, at the local level in their communities. So we understood this from the outset of this Faith for Vaccine initiative and working closely with government, voicing out, this is need to be equitable. This is need to find, to get access to the vaccine to everyone in our society. So reaching out to those who are most vulnerable. I think it is very critical. So for this, through data gathering, we show that vaccine hesitance group in the United States are largely people of faith as well, and how we can really address and reach out to them and use our own religious texts to talk to them about that. We know faith leaders are well positioned in communities, especially marginalized communities, as trusted voices, as mentioned before, with trusted spaces, not only ensuring the inclusion of faith actors in vaccine distribution process, but also supporting their role and capacity is a critical tool for leaders to strategically thinking about how to access marginalized communities. And through our experiences, houses of worship in the United States plays the major role as a vaccination sites. Those are the ones that actually reaching out to the undocumented immigrants, to the elderly people, to the survivors of the Holocaust coming to the synagogue, or farmers coming to Sikh Gurdwara to get their vaccine. So I wanted just briefly to show a brief video for you all here to demonstrate this multi-faith collaboration here in my own neighborhood, where a mosque, a synagogue, and a church work together to vaccinate so far in a synagogue and a church and the mosque about more than 3,000 people, including those who are undocumented immigrants. So let's all watch this 1 minute video.
In Northern Virginia, this mosque is utilizing its community clinic as a COVID-19 vaccination site. The All Dulles Area Muslim Society Compassionate Healthcare Network has been providing medical services to low-income and uninsured individuals for free or at low cost since 2013. The center is run by an interfaith team of volunteer doctors and other medical professionals. In partnership with Fairfax County, Virginia, and VCU's pharmacy school, the center is ensuring the most vulnerable members of the community have access to the vaccine.
I think Adams is really good at making sure that they reach out to the community and we're very involved.
I believe that trust is because we spend the time. And people are not stupid. They can tell who cares. I think that's what builds the trust. That's why they would trust us for the vaccine.
I was so much confused. Should I do it or not? It's like that. Here they convinced me very much. So I'm fully convinced. I'm satisfied for that. No hard feeling, no doubts. So I'm here today for the second shot.
Thank you so much. Sarah, back to you.
Thank you very much for sharing that. And I think it's very clear that joint advocacy from different faiths can send a very powerful message. And I'd like to ask Leon, can you share your perspective on some of the strengths of joint advocacy?
Thank you, Sarah, and I want to thank my fellow panelists for these very touching, moving words. I mean, the video was extraordinary, and I hope we see more such examples around the world. In that spirit, for us, interfaith dialogue is of primary importance. It's part of our daily advocacy, and may I say of our DNA, because it can send a very strong message that crosses religious faiths, and in such an important issue like vaccination, it can add an additional importance and gravitas. In addition, it promotes dialogue, cooperation, and building bridges, solidifying ties and building trust among communities during crisis times, but also hopefully beyond them. It also sends messages to other religious or non-religious communities, government, the media, academia, of the importance of the issue being advocated for. Moreover, it allows for cooperation at the grassroots level, since we enable this understanding and cooperation at the top level. So this top-down approach can have real consequences at neighborhoods, communities, cities, where a big part of the world population lives. So whatever we do here affects the people who listen to us and beyond. And finally, interfaith joint advocacy brings forward the similar principles, the things we share among different religions, reminding the world of the similarities and shared goals of peace and coexistence that we all share, and in that way, strengthening our common humanity. So for us, I think whenever we can have an interfaith approach is a path that we are willing to take, because it only adds value to what we do and strengthens the issue at hand. Thank you, Sarah.
Thank you very much, Leon, for sharing that with us. Ella, I'd like to go back to you, and we've talked quite a lot about the global national level advocacy. I think as faith leaders are often trusted leaders in their communities, and often what faith leaders hear reflect the general community concerns. So much of what we have discussed so far falls into this category, but there are a small number of faith-specific concerns that arise in the rollout of vaccines. Can you tell us something of what these are and how you have addressed these at a community level? Over to you, Ella.
Thank you, Sarah. I'm going to just firstly tabulate some of the concerns that I've heard of from the community in my work with the community. So the first one was differential rollout for the rich and the poor. This is what concerns a lot of people. The second one is, why do we have to take a vaccine? Why don't they find a cure? So this has been some of the things that people have been talking about. The third has been, what side effects will it have if they take the vaccine? The fourth is about indigenous remedies, which they feel are better than taking a vaccine. And is the vaccine compatible with the indigenous remedies? And the fifth one is a conspiracy theory, which has been, making its rounds through the social media and so on. And often the feeling is that this conspiracy is by the rich against the poor. So those are some of the concerns. Now in South Africa, the People's Vaccine Campaign, which is the organization that we all formed, was launched in January. And as part of a global campaign to this, talk about these issues. Faith organizations like the South African Council of Churches, including the Anglican Church of South Africa, the RFP South Africa, and many other community and faith-based organizations came together to talk about this call to action by the People's Vaccination Campaign Committee. It must be noted that this campaign has adopted a strong anti-xenophobic stance. At a local level, the PVC, that's the People's Vaccination Campaign, and ACM, that's the Active Citizens Movement, and other players play an important role in various ways. And firstly, to educate the people about the vaccine rollout, how it's going to happen, what happens, and so on. They are part of a popular education program to address the vaccine hesitancy amongst the people. So to address some of those issues that are raised earlier. In the era of social media and fake news, many people have legitimate concerns about vaccines. And this campaign seeks to address the vaccine hesitancy by clearing up misconceptions and misunderstandings. So when faith leaders speak about these things, then the people trust them and accept the arguments that they bring. But in addition, we, the People's Vaccine Campaign Group, have been addressing a number of issues including playing an oversight role over the vaccine rollout, especially after the negative experiences of corruption over the procurement of personal protective equipment that we saw in our country. Faith organizations are the moral voice of the society and play a key role in holding the public and private sector accountable. We also seek transparency through public calls and information sharing sessions. So we've had many webinars where we've invited both faith-based communities as well as government players to come and clarify some of the issues. We have found that working together, we are able to make a greater impact on our communities and internationally. Thank you, Sarah.
Thanks very much, Ella. I think it's such an important part of advocacy is really addressing the concerns that arise within communities, meeting people where they are so that they can take action. Christo, I want to hand to you. I mean, World Vision is a global organization, but it has a very strong community presence within countries. You must have also encountered some of these issues and concerns. Could you share something about this with us? Thank you.
Yeah, Sarah, actually, so I joined World Vision in the worst time of the HIV pandemic. And so the issues that we see now was also some of those issues that we saw then, and trust and building trust and addressing the issues of trust have been our mantra ever since. I pasted the link in the chat about a Faith in Action report, and it captures some of the lessons which I might not have time to get to address today. But yeah, as we all know, people have been experiencing a barrage of diverse and confusing messages and from so many different actors and channels, and this growing jungle of information and misinformation can purely drown out accurate public health information. And based on our deep experience in relationship with Ebola and Ebola vaccines in a number of countries, we've learned from the onset that the COVID-19, that the issues of trust would become a make or break factor in the decision that people will make and the actions they will take. So while faith actors are not the only stakeholders we need to engage at community level champions, the evidence is very clear that in many contexts, faith leaders have a significant influence in their communities. So my father always said, God gave us 2 ears and 1 mouth, and we had to learn to listen and learn in the process. And we learned that we need to meet people where they are, which in our case included virtual engagement with over 80,000 faith actors through WhatsApp groups, where we just listen closely to understand what are they experiencing, what do they believe, what do they encounter, and why. And we realize how significant the role of faith actors are to address and understand these barriers. We have also, in our different communities, have implemented our barrier analysis methodology to identify contextual enablers and barriers to vaccine uptake. We know beliefs and perspectives are really contextual and can be deeply rooted in traditional culture or religious practices. And based on these learnings and listenings, we have also started to adapt our risk communication to address these unique beliefs in local populations. And I think that's an ongoing process we all must do. Now, even before the COVID pandemic strike, we understood from previous experiences that faith actors often need and seek support in order to share effective risk communications. So we reached out through our networks and have engaged until now about 146,000 faith actors. And in this process, we have provided faith leaders and faith communities with evidence-based public health information and supported dialogues around the values, the faith perspectives, and the theologies that inform people's decisions about vaccines. And As we've implemented and listened over the years, we've been doing the Channels of Hope methodology for many years. We understand that faith leaders and faith communities, they want to understand the full scientific facts, and they want to be connected to other experts and stakeholders in the community. And then they need to be given a safe space to be able to unpack and dialogue these complex faith-related issues that Ella has mentioned. And through that safe space and conversation, they then can develop their own responses in their communities. So when leaders are given the time and the support, they become powerful champions for change. And we believe that trust is the process that we do that jointly by allowing these conversations to happen.
Thank you, Christo, and thank you to all the panelists here today for sharing with such passion your stories and your insights into the conversation. We're now going to move on to answering some of the questions that are coming in on the Q&A, and to moderate this session, I'm going to hand over to Bea. So thank you, Bea, for taking this on.
Thank you, Sarah, and thank you very much to all the panelists. I mean, this was a really, really insightful conversation. Leon, I know that you might need to leave earlier, so I'm going to address the first question that's come from the participants to you. Bingao asks, how do you transmit evidence-based information to policymakers to shape efficient action to promote vaccinations against COVID-19? So I think the question is around how is that evidence how is that evidence being shared that then shapes policies? Over to you.
Thank you so much, Bea, and then again, apologies for having to leave a bit before the end of the amazing event today. We have been part of the UNICEF's Immunization Week campaign, so we shared a lot of content, and part of that is that we are encouraging also our leaders to when they get vaccinated, to share that in social media or otherwise. I myself get vaccinated tomorrow, so I get my first vaccine tomorrow, so I plan to also share that widely and encourage people to do so. So I think doing these sort of like gestures, taking this leadership and showing to the people that the vaccines are safe, that they work, that they have very minimal side effects and they help save lives. I think this is something that every religious leader can do and influence their communities in a positive way. So I think this is something that we're encouraging our people to do, and I think everybody can do the same, and this could have a very positive effect on the ground.
Thank you. Thank you, Leon. My next question is addressed to Reverend Christo, and it comes from Ed Phillips from the Emory University. So Ed has been working with a large number of leaders of Christian churches on ways to address congressional responses to COVID-19 in the United States. He's also been working with the International Association of Methodist Churches, Schools, and Universities. And his question is, what role do you see for church-related schools in addressing vaccine access and vaccine hesitancy? And in particular, how can these respected institutions help address access by serving as vaccination centers? So, Christo, over to you.
Yeah, great question.
Yes.
Well, I think the thing that we've all witnessed over the past few years is the power of young voices in addressing Black Lives Matter, about the U2 movement, and how powerful they can be in terms of being change agents. World Vision recently did a study about the connected generation, kind of the older as the Gen Z generation. But I think the thing that we've learned both about the Gen Z, the current young generation, and the just older generation is these groups act first. They go hands first before they go heads first and hearts first. And sometimes we tend to kind of want to work with the heads and the hearts first, but young people want to be engaged practically. And so if we really want to bring our young people alongside us, as people of faith, we need to help them to understand where they can get connected to this, where they can practically engage. And the example that was provided in terms of Christian schools or church-related schools where they can become part of advocacy for access and for equity, but also practically making their schools a place is an excellent opportunity. And there's not only in the US, there's great examples in Kenya of young people who are standing up for SDG issues and are vocal about the rights and justice. And we must come alongside them as young people and allow them to act and not only know.
Brilliant. Thank you very much. The next question, came from the panelists, and I'd like to, if the panelist allows me, just try to change it a little bit. It talks about, I think one of the, and this was also discussed, we need to acknowledge, some very tangible and very, I think valid concerns that people sometimes have against vaccinations. And one of them have been the historical injustices that, medical experimentation has had, and the kind of mistrust that leads to. And while I don't want to pose a question to our panelists right now to give a solution, but I would like to address this issue of the fact that there are communities that have been experimented upon that have this sense of mistrust. And Ella, if I can maybe perhaps start with you, what do you think? How should these kind of concerns be addressed? And I think it comes under the umbrella of maybe perhaps trust building. How do we look at historical issues and the impact that they have today? How can we address those, do you think? I'd love to hear your views. Over to you. Is Ella on mute?
Okay, sorry.
You're here.
Yeah, I think that, the years of oppression of the Black people, and here I'm talking about all the non-white people who have suffered these oppressions, have impacted on the way that we perceive things, the way we see this experimentation, for instance. Why experiment only on Black communities, poor communities, and so on? Why not have a wider range of people? Why is it that the rich people are not part of the experiments when they are conducted? These are the kind of questions that we get from the community. And I think that it arises from the years of exploitation that poor people have experienced and feel that because of their poverty, this kind of advantage is being taken over them. Now, I think that as faith leaders, we need to change that scenario. We can't just appease the poor, but we need to change that scenario where we need to tell the scientists, please change the way you do these experiments. Don't use only one section of the community for these kinds of experimentation. So I would say that is how I look at it. Because if we talk about equity, then that is what equity is all about.
Right. Thank you, Ella. Thank you very much. If I may now turn to Dr. Muhammad for the next question. It's coming from Andrew Koo, and he asks, in countries where religion is a politically sensitive issue and the government is not used to listening to faith leaders, what approach would the panel suggest for religious leaders to take? So how, to give more space to religious leaders influencing the government in politically sensitive spaces. Muhammad, I would love to hear your thoughts.
Yeah, thank you, Be here. And so before answering these questions, I just want to add to the previous question and eloquently answered by Ella as well. And that is really to address these injustices, we need to acknowledge that they were historical injustices, and we have to address these grievances that it has like a historical connotation. And also want to say that we need to learn from the past as well. We face problems in polio, for instance. and the role of religious actors, probably you know this, in the area like Pakistan, Afghanistan, and Nigeria. Religious actors, they have a role to play in actually issuing religiously based opinions to ask people to get the vaccine and all of that. So I think we have to acknowledge, and then we have to use our resources and our moral value. But we also understand, just to answer your question directly now, here is that, yes, we know that it's not always easy for religious leaders to function, particularly in countries that there is no democracy, there is violations of human rights, there is no freedom of speech or expression. So it's going to be challenging here. But we have seen religious actors actually working using their own resources and means, and slowly and gradually collaborating with these governments. And here, the role of religious actors and faith-based institutions who are, based on in countries that allow and they have the freedom to share their experiences with the globe, with those who are living under oppression, so that to talk about their rights, to advocate on behalf of them, that their voices are really critical. They need to talk to the government. You need to consider listening, because in the pandemic, even before the vaccine actually came, we know that the interfaith communities collaborated together to address, issues of coronavirus, right? Issues related to burials and issues related to social distancing in an interfaith way. Then the government came actually and realize that and acknowledge that. I mean, I can give you a specific example in Kenya, for instance. The government recognized the interfaith collaboration in addressing the coronavirus issues early on, right? And that's because they have that access to the community, and they're the one that is attached to it. So it is challenging. We need to recognize that, but it is doable in the same time.
Thank you, Muhammad. That was very clear. Thank you so much. Maui, I'm sorry if I'm pronouncing your name, but my next question is going to be for you. It comes from Ariel, who asks, could you share your thoughts on how to address health system power inequalities to overcome the challenges of those most excluded and vulnerable, and being the last in the queue? So what can we learn from previous experiences on more equity over here? But I think also addressing the health system concerns. Over to you.
Okay, yeah, health. I think Christo said a little more experiences on equity in terms of care during the era of the difficult times of HIV and the huge campaigns that were mounted and supported to a very big extent by faith communities. You remember that the first line of medicines were only adult formulations. Yeah. And children did not seem to be a little version of adults. And to get pharmaceuticals to actually start making pediatric formulations was not very easy. So those type of socio-economic analysis of situations. So I think in a way, faith communities are not necessarily anti-science, and they must find scientific minds within their communities that can help them do very credible social analysis of issues and bring those analyses to the faith leaders. Most of these issues, especially health issues, it's biology. And how many of us can remember our high school biology? And the way vaccines work and this and that. So we need also to create what others have already said, trust. There are many aspects of life that we trust. We know the professionals in those areas. We can't understand everything. You can't understand everything in everything. And so you can't expect everyone yourself to understand fully how the molecules here and that work. It's not possible. So there's a way that we know their ethical scientists. And so I think identifying and building that pool of scientists and that can speak to that particular faith community, even the particular social community that are marginalized and are carrying a lot of trauma from the past. There can be a voice that they can listen to. There can be a voice that they can sit and say, yes, I am one of you. This is true. I am one of you. This is not true. So I think facilitating that type of search for the right voice and doing a social analysis of issues, contextual analysis of issues, and then elevating this voice. And within that, you find that actually it will be possible to identify sections of the society that are marginalized, that are left behind, and understanding pretty well how these are left behind and why. And I think that can give rise to evidence-based solutions. Thank you.
Thank you. Reverend Christo, did you want to add anything to this? Otherwise, I have another question for you.
No, you can go for the other one.
Are you sure? Okay. So, Reverend Christo, this one is coming from Bolivia. And the question goes, here in Bolivia, some religions had made some flyers saying that the vaccines have a sort of chip with the 666 number on it. And it's really an issue for the healthcare provider to help them understand that the vaccines are good. So how would we address that? How would they address this?
Well, I saw that question pass by and was hoping that you're going to ask me that one. Actually, I didn't realize how widespread that myth got. It originated somewhere, I won't say Bahu, but and it took over in the world, over everywhere. And it has really been for the Christian constituency, something that was there. It's this mark of the beast. And now everyone is going to be controlled. And what we have learned is that this is going around and will continue going around until we start to come alongside, well, in this case, Christian leaders, to be able to understand how to read the Bible properly and to really understand that that message that it actually referred to was not a message of fear, it was actually a message of encouragement, and that is wrongly interpreted. And that's the role that I think we need to play as development agencies of faith, to look at our own scriptures and come alongside faith leaders to provide them the way to struggle with these texts, but also to help them to read their scriptural text in a way that is appropriate for today.
Thank you. Thank you so much. I'm being conscious of time, and there are a lot of questions actually that have come from the participants that I don't think we have the time to get into. What we'll do is we'll tabulate them, and as you know, this is the first of many series of webinars that will take place, and we really hope that somewhere or the other we are able to address them. So I really apologize to the participants if your question was not addressed right now, but we will, there's going to be a recording, and if there's anything very urgent, we will try and get back to you with an answer. But with that, I mean, I would like to wrap up the session of question and answers and maybe hand it back to our wonderful panelist teams for any, I think, for any final remarks based on, like what the kind of questions that have come, what you feel at the end of these hour and 10 minutes so far. And if you allow, I'd love to start with you, Ella, for any last minute, any final comments from your end.
So I think that there are 5 things that I just want to tabulate. Number 1 is that vaccine equity is just the tip of the iceberg, because there needs to be equity in terms of strengthening people's immunity, strengthening people's health, and so on. And as we can see, when we are poor, we do not have access to these kinds of facilities to strengthen our immune system. So that's one of the issues. The second issue is the question of trust. We have spoken about it, and I think we can't emphasize that point more, that people, for people to trust us, we need to also, like it was said earlier, we have to live a life that, makes other people trust us. The third is transparency. We have to make sure that powers that be government, scientists are transparent in what they say and explain things in a way that people can understand. The fourth thing is togetherness, and cannot emphasize more the importance of coming together in order to achieve things. And the last one is training. That when we are speaking to people, we need to have facts on our hands. If we don't have those facts, then it becomes very difficult to go out there and talk to people. So, yeah, thank you.
Thank you. And thank you so much for making that point, because I know this was an issue that we were not able to address in today's webinar, but I think this training and capacity building is definitely, and how can we strengthen the, like whatever gaps there might be to make it an even stronger advocating community, I think is really critical. So thank you for bringing that up. And I really hope we can have an opportunity to explore this further in the next set of webinars. Can I move next to Dr. Makako for your final comments and thoughts?
Okay, it is one of the SDG sustainable partnerships. And so one final thought I would love to say is that leaders, government leaders, business leaders must find ways of developing sustainable relationships with faith communities. These relationships cannot be functional just on an ad hoc, a last minute, during moment of crisis. Oh yeah, we need partners. They need to be mutual. They need to be sustained. They need to be cultivated. They need to be respectful. So that requires long-term, and this should not be the end. Secondly, I would say that many issues that have been major bottlenecks on COVID-19 are not new things. Most of them are pre-existing. Some of them were well known, but maybe not well appreciated. The issues of equity, the issues of primary health care, the general health of the people. Most of these are old problems. They've just come with the new guise. So this gives us an opportunity, because now it is a moment of crisis. And there's a word that let's not waste the crisis. Sometimes a crisis can be wasted. So if we just say, oh, this is just COVID, and we just say COVID, get out of COVID, okay, COVID is over, it will be a crisis wasted. And to maintain a sustained engagement as the World Council of Churches, we are producing some materials and accompanying programs to help the member churches and other Christian communities to have sustained health promotion programs that have credible health promotion, practical activities within communities, advocacy, and public witness. So we have some resources and materials that are to that, but we see that faith communities can be communities of healing, and that healing has to take several components. Thank you. I can share in the link some of these resources for those that may be interested to refer to them.
Thank you. Thank you very much. Mohammed, may I move to you, please, for your final comments and thoughts?
Yes, thank you. Thank you so much, B. And thank you for organizing this again. And this is definitely, I'm glad that you are going to have a series of this discussion, because a lot of issues came out of this discussion deserve, kind of separate webinars. Faith and science is something that's really very critical. And we know that the hesitancy there and how to address that hesitancy. We experienced this here in the United States. I had to invite actually Dr. Francis Collins. He's a man of faith. He's the director of the U.S. National Institute of Health, to the table to address faith and science. Again, he's a man of faith, is known, and also a known scientist. So people can listen to him. So this might need another discussion, but it's important. Also, I want to highlight, we didn't get a chance to talk about this. Our faith-based institutions and faith actors are aging, and we have to engage youth and in inclusive way to address and include everyone. No one should be left behind, the role of women and all of that, as we continue to address COVID and other issues as well. So this is a critical, and I hope that one of your webinar will focus on that. But in closing, also, I want to emphasize that, there is still so much untapped potential surrounding the engagement of faith communities and vaccination efforts. So here at Faith for Vaccines, we're exploring how to best link faith communities with local, state, and federal health authorities. As I mentioned earlier in the beginning of my remarks, faith communities are willing and able to support equitable vaccine distribution and combat hesitancy. We need to ensure we provide these communities with the opportunity and resources. Capacity was mentioned to assist vaccine distribution in order for our country here in the United States and the global, of course, to effectively and quickly respond and recover from the pandemic. And again, as the general director or director general of the World Health Organization said, everyone should be safe. Otherwise, no one would be safe. Thank you so much.
Thank you, Mohammed. And thank you so much for giving us so much fodder for the next webinars. We needed that, and this is fantastic. So thank you. I really thank you very much for this. And Reverend Christo, over to you.
Yeah, well, I want to hook onto what Mwai and Mohammed and Ella also said about the whole thing about unity.
Yeah.
As people of faith, our advocacy, whether we do it to God in prayer or to governments or to communities for equity and access to vaccines for the most vulnerable, is driven by our core beliefs. For me as a Christian, or for World Vision as a Christian organization, we are called to love our neighbors like ourselves, right? And every one of our faith will have a principle to hook this onto. That underpulls our call for solidarity and equal moral concern for. So the principles of our faiths, and for me, the Bible, the sage principles, and the fair allocation are fully aligned in prioritizing the most vulnerable. The impact that children have already suffered in this pandemic, whether it's increase in violence, interruption in education, increased economic vulnerability or mental health challenges, it's well documented, and the evidence is growing around this. We are called to really stand up for the most vulnerable, for the poor, the disabled, the marginalized, the displaced, and for children. And we must make sure that they are provided for and represented. And together we will be able to do that. As World Vision, we have assessed the national deployment and vaccination planning processes, and we found them lacking in terms of representation and prioritization. They've not sufficiently included community engagement planning and financing. And equally, we have found that global investment and preparedness for the last mile implementation and community engagement is also lacking. So while much discussion has been going on globally around vaccine manufacturing, that is actually just the beginning of the equity conversation. Equity requires that the most humble voices from local communities, including the poor and children, must be heard and must be reflected in this. And lastly, for me, as a church leader myself, I recognize that faith leaders have a massive responsibility to represent and to communicate responsibly to their own communities. And we must do our part to make sure that we seek out the accurate information and we share it with them. We cannot do this alone. We must have open dialogue. We need to be listened to, and we need to listen. We must engage and be engaged. We must be inclusive and be included. So together as multilaterals, as health workers, as governments, as faith leaders, as development practitioners, I believe we can and we will build a world where vaccines are available to the most vulnerable, where communities can ask questions and can get the accurate information they need to be able to make the decisions for themselves and for their families. I believe together we can end this pandemic.
Thank you. These were such powerful and such positive words to end this discussion on. I mean, it has been a pleasure to speak to all of you and to have our participants engage with you. I'm going to hand over to Deepika with a very difficult task of summing all of this up. But from my end to all of you, this wonderful, wonderful panel, thank you for your thoughts, for your words, for your guidance, your wisdom, and for summing so many of these crucial issues together. And we really hope to address them as we go forward with, jointly. So thank you very much. And Deepika, over to you.
Thank you, Bea. First of all, a deep gratitude to all the wonderful panelists. And I am sure I will not be able to do justice to all that wonderful conversations we've had, but I will make a humble attempt in sort of reflecting some of the highlights of the discussions we've had today. So we have heard such inspiring yet very practical experiences that are truly making a difference around the world. There is Faith for Vaccine that is working to ensure equitable vaccine distribution and combat vaccine hesitancy. World Jewish Congress and the World Council of Churches statement touched upon the ethical question related to vaccine distribution and therefore the need for religious leaders and faith-based organizations to engage in policy discussion. World Vision emphasized on its global and grassroots efforts to ensure vaccine accessibility and acceptance with focus particularly on children and vulnerable communities. We also heard so eloquently what fears and concerns are being encountered and how organizations such as Religions of Peace South Africa and Gandhi Development Trust is working to advocate to break down the divisions between the rich and the poor and fight against profiting on the suffering of others in its advocacy for vaccine equity. We touched upon today the need and the role that religious leaders and institutions play to build trust, provide solace and solidarity, relay correct information, both scientific and religious, create safe space to share concerns and differences. Also mentioned was the need for the religious leaders to live by example, to inspire others, give voice to the voiceless, and also engage youth who are change makers. We also heard, and Religions of Peace knows very well how powerful and impactful it can be when diverse faith traditions come together to speak in one voice and work shoulder to shoulder. It was also mentioned the importance to have space for interreligious dialogue and the need to people of faith to come together. A very clear clarion call was made for transparency and accountability in which religious leaders and faith-based organizations can play a powerful role. All agree that vaccines should be distributed on the principle of equity and in a fair and transparent way. Lack of transparency as well as myths, miscommunications, rumors can lead people to lose trust in vaccines. Religious leaders and institutions can address these issues and ensure that their communities have the right information, not only to overcome vaccine hesitancy, but also to equip people to hold relevant authorities accountable. Today, we also heard much has been done, and yet we cannot and should not rest on our laurels. There is still much more to be done. We need and we must work towards ensuring fair and equitable vaccine for all. The moral values of each of our faith mandates it, our shared well-being requires it, and in fact, our very own survival demands it. So thank you so much. Hopefully that sums up a little bit, just gives a slight taste of what was actually a very rich discussion. Thank you. Over to you, Sarah.
Thank you so much, Deepika, and it's not an easy job at all, especially after such a fantastic panel. Just to mention, of course, that we will be documenting this webinar and we will be able to share that with participants. This will be part of a series, as we've said before. So Alex has been posting in the chat the email list that you can sign up to if you do want to receive subsequent invitations. I just want to say thank you to all our panelists and all the folks in behind the scenes who have made this possible. I'm personally very excited to be a part of this conversation with you. It really is an honor. And We look forward to future events, and we look forward to hearing from the panelists and the participants of the webinar as we take this forward. So thank you to everybody, and I wish you a safe rest of the day wherever you are. Goodbye, everybody.
Thank you. Bye-bye.
Bye.
Bye-bye.
Bye-bye.
Bye. Thank you very much.
Thank you.
Bye.
Thank you, Ella. Bye.
Bye.
Okay, thanks. Bye.
Bye, Mai.